Growth factors, chapter 23. Hemopoiesis, its definition is the biological process that produces the body's blood cells and platelets. The therapeutic uses replacement of neutrophils and platelets after chemotherapy, hastening of bone marrow function after bone marrow transplant, increase in red blood cell production for clients who have chronic kidney disease. There are three groups of growth factors. They have your erythropoietic growth factors, which is your erythropoietin, leukopoietic growth factors, which is your granulocyte colony stimulating factor, granulocyte macrophage colony stimulating factor, thrombopoietic growth factor, your interleukin 11. Okay, so drugs, the first ones we're going to talk about are your erythropoietic growth factors. EPO10, alpha procrit, which is your erythropoietin. It acts on the bone marrow to increase the production of red blood cells. Therapeutic uses: anemia due to chronic kidney disease, anemia resulting from chemotherapy, anemia resulting from taking zidovudine, which is for HIV and AIDS, and elective surgery to help increase your red blood cells preoperatively. Okay, contraindications can be cardiac events, so your MIs, your strokes. This is due to elevation of your hematocrit, so we need to make sure we monitor the H&H. Risk of thrombotic or thrombic event, which can be due to the stroke, the myocardial infarction. The cardiac event too is your hypertension, cardiac arrest, and heart failure as well. So if it's higher than 11, or there's an increase of 1 gram per deciliter in 2 weeks. Seizures may be caused due to rapid onset of blood, rise in blood counts, clotting factors or clots in the dialysis equipment. Deep vein thrombosis, they're at risk preoperatively, so they may prophylactically treat them prior to their surgery. Headaches, body aches, they report headaches that are frequent or severe. It may be caused due to hypertension. Contraindications: pregnancy risk category C, uncontrolled hypertension, some cancers. Major nursing measures or considerations: measure blood pressure. This can be given subcutaneously or IV. Do not aggregate, dilute, or mix with other medications. Monitor iron, folic acid, and vitamin B12. Monitor hemoglobin and hematocrit twice a week within the target range. Monitor CBC and differential routinely. And then monitor chemistry panel: BUN, uric acid, creatinine, phosphorus, and potassium. Okay, leukopoietic growth factors, your granulocyte colony stimulator factors. This is your filgrastim or Neupogen. This will stimulate the bone marrow to increase the production of your neutrophils, so your white blood cells. It's going to help decrease the risk of infection, build up the numbers of hemopoietic stem cells prior to harvesting for autologous transplant. Complications can be bone pain, so we need to monitor that and notify the physician if it happens. They can administer acetaminophen or an opioid analgesic if the acetaminophen doesn't work. Leukocytosis, so this is reduce the dosage to interrupt treatment if the white blood cell count is above 100,000, or absolute neutrophil count exceeds 10,000. So normal range is 4,500 to 11,000, and neutrophil range is 1,000 to 8,000. So, or 1 to 8, which is 1,500 to 8,000. So you're going to monitor the CBC at least twice a week while they're getting treatment. Elevation in uric acid, lactic acid dehydrogenase, and alkaline phosphatase. Just monitor. Elevations are moderate but reversible without intervention. Splenomegalia, which is enlarged spleen. This is more with long-term use. They're going to complain of left upper quadrant abdominal pain, shoulder tit pain needs to be reported to the provider because they are at risk of splenic rupture. Contraindications, pregnancy risk category C, sensitivity to E. coli protein. Precautions, bone marrow, sickle cell disease, or respiratory disease, and breastfeeding. Nursing considerations, IV bolus, continuous IV, subcutaneous infusion, or sub-Q injection. Do not aggregate, dilute, or mix with other medications. Monitor CBC 2 times per week during treatment. Self-administration, sub-Q, reinforce instructions. Now we're going to do the granulocytes. Macrophage colony stimulating factors. This is your leukin. It acts on the bone marrow and to increase the production of the white blood cell count. So your neutrophils, your monocytes, your macrophages, your eosinophils. It's going to hasten the blood marrow function after the bone marrow transplant. Treat failed bone marrow transplant. Treat older adults acute myelogenous leukemia after induction of chemotherapy. Complications, diarrhea, weakness, rash, malaise, bone pain. So monitor for these to occur. They can give acetaminophen to help combat some of this. Leukocytosis, thrombocytosis. So we need to monitor these two. You need to interrupt treatment for absolute neutrophil counts of 20,000 or greater and white blood cell counts of 50,000 or greater, or platelets of 500,000 or greater. First pass effect, so tachycardia, hypotension, chills, fever, diaphoresis, and dyspnea can occur with the first dose. Check carefully with these effects and notify the physician. This effect is not expected with any subsequent dose. Contraindications, pregnancy risk category C, allergies to yeast. Precautions, lung, cardiac, kidney, or hepatic disease, hypoxia, peripheral edema, bone marrow cancer, or pleural or pericardial effusion. Nursing considerations, your baseline CBC, differential platelets, IV infusions. You need to slow or stop the infusion if the client has pre-existing heart failure or respiratory disorders. Then the last one, your interleukin 11, increases the production of platelets. Therapeutic uses is to decrease thrombocytopenia and the need for platelet transfusions for clients receiving chemotherapy. Complications, fluid retention, so peripheral edema, dyspnea on exertion, monitor eyes and nose, make sure wait, watch for edema. Cardiac dysrhythmias, tachycardia, atrial fibrillation, atrial flutter, so monitor vital signs, heart rate, heart rhythm. Eye effects, conjunctival injections, transient blurring of vision, papilledema, which is that inflammation of the eye and the eyelid. If you observe any of these, stop the medication and notify the physician. Allergic reactions, possible anaphylaxis. You need to watch for any indications of a reaction to the medication. Contraindications are bone cancer, precautions, heart failure, pleural effusion, or cardiac dysrhythmias. Nursing considerations, baseline CBC, platelet count, electrolyte levels. Reconstituting with sterile water and swirl the vial. Do not combine with other medications. You need to use this within 3 hours. Refrigerate if there is a delay in administration, and subcutaneous injections daily.